Welcome to Medical Facts.
In this video, I'm going to walk you through 8 warning signs your body needs vitamin K2. These are subtle clues you might be ignoring, and they don't just affect your bones, they could impact your heart, skin, teeth, and even your energy levels. Don't forget to consult your doctor before making any health changes, especially if you're thinking about supplements. Now, let's get started. 1. Arterial calcification. When calcium starts building up inside your arteries, turning flexible blood vessels into hardened tubes, it's a clear warning sign that your body could be running low on vitamin K2. Most people think calcium is always a good thing, but when it's not managed properly, it ends up in the wrong places. That's exactly where vitamin K2 steps in. It doesn't increase or decrease your calcium levels, it redirects them, keeping calcium out of your arteries and moving it into your bones and teeth, where it actually belongs. Now here's how the problem starts. Inside your arteries, there's a protective protein called matrix GLA protein, or MGP. Its main job is to block calcium from sticking to the artery walls. But this protein may only do its job when it's activated by vitamin K2. Without enough K2 in your system, MGP stays inactive, and that's when calcium gets deposited into the walls of your arteries. This process is called calcification. Over time, these arteries begin to stiffen, your blood has a harder time flowing through, and your heart has to pump with extra force just to keep circulation going. That added pressure raises your risk for heart disease, high blood pressure, and even sudden cardiac events. What's really scary is that arterial calcification usually shows no symptoms until it becomes severe. You won't feel pain or notice anything out of the ordinary until the damage is already done. That's why it's crucial to recognize this as a silent early signal that your vitamin K2 levels might be out of balance. If your calcium-rich diet isn't paired with enough K2, you could actually be feeding the problem instead of solving it. Think of K2 as the traffic cop for calcium. It tells it exactly where to go and where not to go. Without that guidance, your arteries could slowly harden, and you might not even realize it's happening. According to research, 47% of heart patients taking vitamin K2 for 6 months saw reduced artery calcification, while 80% without it showed worsening calcium buildup. 2. Frequent cavities despite good oral hygiene. When your oral hygiene habits are solid, but you're still facing tooth decay, it could be a deeper nutritional issue, one that has nothing to do with sugar or brushing technique. What most people don't know is that your teeth aren't just protected from the outside, they're also supported from within. And vitamin K2 plays a key role in strengthening your teeth from the inside out. Your teeth, just like your bones, need calcium to stay strong and resist decay. But it's not enough to simply have calcium in your diet, it has to be placed in the right spot within your tooth structure. That's where a special protein called osteocalcin comes in. This protein acts like a glue that binds calcium into your enamel and dentin, which are the hard protective layers of your teeth. But there's a catch. Osteocalcin can't do its job unless it's activated by vitamin K2. Without enough K2, that calcium doesn't lock into your teeth. Instead, it floats around aimlessly in your system or ends up where it's not supposed to be. So even if you're eating healthy, using fluoride toothpaste, and following all the right steps, your teeth might still be vulnerable because they're not getting the internal mineral support they need. That's why cavities may keep popping up despite all your effort. You're protecting your teeth from the outside, but your body isn't reinforcing them from the inside. And what's even more interesting is that vitamin K2 also works together with vitamin D3 to guide calcium efficiently. D3 helps absorb calcium, but K2 ensures it's delivered into your teeth, not just into your bloodstream. According to research, vitamin K2 helps protect teeth by preserving dentinal fluid flow, reducing oxidative stress, and enhancing saliva's buffering capacity. It supports calcium and phosphate secretion, strengthening enamel and dentin against acid erosion. 3. Easily bruised or persistent nosebleeds. If you're someone who bruises from the lightest bump or finds yourself dealing with random nosebleeds without warning, it might be more than just sensitive skin or dry air. These small but frequent issues may actually be early signs that your body is struggling to regulate its internal clotting system, and vitamin K2 could be playing a bigger role than you think. Blood vessels, especially the tiny capillaries close to the surface of your skin or in your nasal passages, rely on flexibility and structure to withstand daily wear and tear. When vitamin K2 levels are low, a protein called matrix GLA protein, which helps keep vessel walls strong and elastic, doesn't get activated. Without this activation, those delicate vessels become fragile, making them more prone to breakage even under normal pressure. This leads to bruising from minor contact or nosebleeds that seem to appear out of nowhere. But there's more to it. Vitamin K2 also helps regulate calcium in your bloodstream, which indirectly affects your clotting mechanism. If calcium ends up where it shouldn't, like in the soft tissues of blood vessels, it may interfere with the natural clotting process. That means even small injuries or dry nasal membranes may bleed longer or more frequently than they should, but simply because your body isn't sealing things up the way it's supposed to. And while vitamin K1 kicks off clot formation, it's vitamin K2 that ensures vessel walls are strong enough to hold that clot in place without rebleeding. According to pediatric neurology, newborns without vitamin K are at risk of severe bleeding. In one study, 5 out of 7 deficient infants bled, and 4 had brain hemorrhages. 4. Bone fractures or weak bones without osteoporosis. You know that feeling when dealing with frequent fractures or aching, fragile bones? That's a red flag your body could be missing a key nutrient behind the scenes, vitamin K2. Deep inside your bone structure, a protein called osteocalcin is responsible for binding calcium into the bone matrix, giving your bones the strength and flexibility they need to handle stress. But here's the kicker: osteocalcin can't do anything until it's activated by vitamin K2. Without enough K2 in your system, this protein stays inactive, and as a result, calcium doesn't integrate properly into your bones. That means the outer density might look fine, but the internal structure becomes weak, brittle, and prone to cracking under pressure. To make things worse, if your diet includes plenty of calcium but not enough K2, that calcium may not even make it to your bones at all. It could get lost in circulation or settle where it's not supposed to. So what you're left with is a bone system that's mineral-rich on the surface but hollow and vulnerable at its core. And unlike osteoporosis, which usually shows up in test results, this kind of silent fragility may go completely unnoticed until something breaks. According to PubMed, a study on adults aged 50 to 75 found that vitamin K2 significantly reduced bone loss in postmenopausal women over 1 year. 5. Sharp, localized joint pain without inflammation. You know that odd, pinpointed joint pain that seems to come out of nowhere? That kind of unexplained joint pain could be a warning that you're not getting enough vitamin K2. Cartilage acts like a cushion between your bones, keeping movement smooth and pain-free. But when your body doesn't have enough vitamin K2, something unusual starts to take place. Calcium, instead of staying in your bones where it belongs, begins to deposit into soft tissues, including your joint cartilage. These calcium crystals may build up silently, creating tiny points of pressure within the joint. And since there's no infection or classic inflammation involved, the pain feels sharp and isolated, not swollen or warm like typical arthritis. This misplacement of calcium doesn't just hurt, it also affects how your joints function. Over time, movement may become restricted, and the cartilage may begin to stiffen and wear down from the inside. What makes this especially tricky is that traditional scans may not pick up on these early-stage calcium deposits unless they're advanced. That's why many people go years with unexplained joint discomfort, never realizing that their body's calcium delivery system is out of sync. And that delivery system? It depends heavily on vitamin K2 to guide calcium where it's truly needed. According to the American Journal of Medicine, subclinical vitamin K deficiency doubled the risk of knee osteoarthritis and cartilage damage, but showing its crucial role in maintaining joint health. 6. Calcified breast tissue in mammograms. You go in for a routine mammogram, expecting everything to be fine, and then you're told there's calcification in your breast tissue. One of the lesser-known reasons for this could be a lack of vitamin K2. And while these calcifications are often benign, their presence may be a sign that your body's calcium-regulating system is off track, and vitamin K2 may be exactly what's missing. Your body naturally transports calcium through the bloodstream for essential functions like strengthening bones and supporting nerve signals. But it's vitamin K2 that acts like the traffic director, making sure calcium deposits in the right places. When K2 levels are low, that control system breaks down. Calcium may then drift into soft tissues, like the breast, where it gets lodged in the ducts or lobules. These deposits are what show up as white spots or specks on a mammogram. They aren't always dangerous, but they do reveal a pattern. Calcium is getting lost along the way, and that could create problems in other parts of the body too. These breast calcifications become particularly common with age or in postmenopausal women, which is also when vitamin K2 deficiencies tend to rise. Without enough K2 to activate proteins that prevent calcium buildup in soft tissue, your body slowly starts storing it in places where it doesn't belong. It's not just about breasts. This same mechanism is happening in arteries, joints, kidneys, and skin. But the difference with mammograms is that these calcifications are visible, giving you a clear signal that something's off before other symptoms even begin. According to PubMed, women with breast arterial calcification had significantly lower vitamin K2 levels, and suggesting K2 may help protect against calcium buildup in breast arteries. 7. Coronary artery calcification scoring higher than normal. If you've ever had a coronary calcium scan and were told your score was higher than it should be, that number isn't just a statistic. It's a serious early warning your heart is under stress. Even if you feel fine, a high coronary artery calcium score is a strong indicator that plaque and hardened calcium deposits are silently building up inside your arteries. What's often missing in that conversation, though, is the role of vitamin K2. Inside your arteries, calcium may either help or hurt, depending on how well it's being managed. Your body uses proteins like matrix GLA protein to keep calcium out of artery walls and away from soft tissue. But this protective protein needs to be activated by vitamin K2 in order to do its job. When K2 is in short supply, the protein stays inactive, and calcium starts sticking to the inner walls of your coronary arteries. This buildup turns into calcified plaque, which narrows the arteries, reduces blood flow, and raises your risk for serious cardiac events like heart attacks or angina. What makes this even more dangerous is how quietly it happens. You won't feel calcification as it forms. There's no pain, no discomfort, just a gradually climbing calcium score that often shows up during routine heart scans. And while cholesterol levels and lifestyle definitely play a role, a deficiency in vitamin K2 may silently amplify the damage by letting calcium settle where it absolutely shouldn't. Think of K2 as the nutrient that keeps your arteries clean from the inside, like a natural traffic controller for calcium. According to Science Direct, people with high coronary calcium who took vitamin K2 for 24 months had slower calcium buildup and fewer heart-related issues compared to those who didn't. 8. Delayed wound healing. You cut yourself doing something minor, maybe in the kitchen, or just bumping into something, and days later, the wound is still open, tender, or slow to close. It's not infected, but it's healing way more slowly than it should. If this keeps happening, your body could be trying to tell you something important. It may be running low on vitamin K2. When your body experiences a wound, a complex healing process kicks in, starting with clotting to stop bleeding, followed by inflammation, tissue rebuilding, and finally remodeling. Vitamin K2 steps in during the rebuilding and remodeling phases. It activates proteins that manage where calcium is sent during the healing process, ensuring that new tissue forms with proper structure and flexibility. Without enough K2, calcium may end up deposited in soft tissue around the wound site, slowing down recovery and causing the newly formed tissue to be stiffer, weaker, or less resilient. At the same time, vitamin K2 plays a role in supporting cellular signaling. This means it helps regulate how your immune and tissue cells communicate while they're regenerating skin, blood vessels, and connective tissue. If K2 levels are low, this signaling becomes less efficient and the repair process drags on. The body might struggle to close even small cuts properly, and scar tissue may form more irregularly. This isn't just about cosmetic healing, it's about your body's deeper ability to bounce back from injury. According to Frontiers in Pharmacology, animal studies showed that vitamin K2 significantly boosted wound healing rates. Moving on, let's discuss 5 powerful foods to boost your vitamin K2 naturally. If you're like me, you're probably always looking for simple ways to support your health without overloading on supplements. And when it comes to vitamin K2, the nutrient your body needs for strong bones, clear arteries, and healthy teeth, it turns out you may get a good dose just by adding the right foods to your plate. So if you're wondering how to naturally raise your K2 levels, here are 5 delicious options you may start eating today. 1. Natto. This traditional Japanese dish made from fermented soybeans is the richest natural source of vitamin K2, especially the MK7 form. Just a small portion may give you more than your daily requirement. The flavor's intense, but if you can handle it, it's a K2 powerhouse. 2. Hard cheeses. Certain aged cheeses like Gouda, Edam, and Jarlsberg are packed with vitamin K2 due to bacterial fermentation. They're not just tasty, they also support bone health and help keep calcium where it belongs. 3. Egg yolks from pasture-raised hens. Egg yolks from chickens that roam and forage contain significantly higher levels of K2 than conventional eggs. Add them to your meals for a smooth, easy way to up your intake. 4. Grass-fed beef and liver. Meat, and especially liver from grass-fed animals, offer a natural source of MK4, a fast-acting form of vitamin K2. But incorporating these into your diet a couple of times a week may really move the needle. 5. Fermented foods like sauerkraut. While not all fermented foods are high in K2, certain homemade or traditionally fermented veggies like sauerkraut may carry small amounts, especially if prepared with the right bacterial cultures. They're great as a gut-friendly side dish too. You've probably heard a lot about vitamin D and calcium, but vitamin K2 barely gets mentioned, even though it plays a powerful role in how your body works. I'd recommend taking a closer look at your diet. You may find K2 in foods like natto, hard cheeses, pastured egg yolks, and grass-fed meats. But sometimes, even with good eating habits, it might not be enough, especially if there's a long-term deficiency. That's when a healthcare provider may help you figure out if supplements are needed.